Good afternoon. I am Dr. Lata Bhat. I am a pediatrician who is specially trained for newborn care and for developmental problems of children. Now today I am going to talk about one of the conditions which is very common. It's known as ADHD, Attention Deficit Hyperactivity Disorder. Many of you may have read about it in the newspapers or online. About 8 to 10% of school children have this problem. Now this is not a disease, you need not be scared of this problem. All we need to know is to understand the kids and provide support. And this is essential both by the parents and by the teachers. These kids have generally poor concentration. They are very easily distractible. That means even if there is a doorbell rings, or if there is a horn, or if somebody is playing music or television, or if somebody in the surrounding is talking and laughing, their concentration gets distracted. They are hyperactive. They may or may not be hyperactive because the core component is lack of concentration, which affects their studies, but they may be hyperactive. They may be impulsive, which means they may act without thinking. They may land up into frequent fights because of that, and they may have certain behavioral issues which teachers and parents may find difficult to handle. They may have learning disability, which can be because of lack of concentration, or it can be a specific learning disability. Now, no need to get worried about it. All you need to do is to contact a developmental pediatrician, get the right assessment done, and then coming to the management of these children. First and foremost is how you handle the children. How the parents and the teachers handle the children is very important. They need a lot of attention, so kindly give attention, but it should be positive attention. Always praise and encourage for whatever good they do. Never criticize. If there is a bad behavior, you first explain to them, and then if it's a very small kid, you can sometimes distract them so that their mind gets distracted from the bad behavior and they calm down. There is something called household rules. You can fix certain household rules, you can fix certain routines so that children understand the do's and don'ts, so that which itself takes care of 50% of the problems. And still if they behave badly, you can count up to 10, and then there is something called time out. Time out means 1 minute per year of age. 5-year-old child, 5 minutes. Time out is lights off, TV off, nobody is talking to them. Physical, visual, verbal attention, all three are not given by anybody in the house, and child is made to sit in a corner. And at the end of it, you hug the child and tell them that you are very good, the child is very good, but that behavior was bad, so that the child does not lose his self-esteem, because self-esteem of a child is supreme. Your behavior should always uplift the self-esteem of a child. Second thing you have to remember is never criticize, never compare your child with any other child, and all the adults should follow the household rules consistently. Coming to studies, they have very short attention span, so you have to give short targets for studies and give breaks in between. They need 1:1 attention for studies, which means somebody has to sit with them while they are studying at home, either by tutor or by the parent. And in the school, the teacher should make sure that they are sitting in the front row, close to the teacher, away from doors and windows, and they give a little extra attention in the terms of, like, if there is something written on the blackboard, they can draw the child's attention to themselves and say. Apart from this, you also need to remember that you have to decrease the TV, video, mobile, computer watching. These lead to hyperactive brain. You also need to limit the amount of chocolates and fast food that they take. Remember, by understanding the condition, you and the teachers can really make a difference to the child's future. For any other further information, you can contact me on library.com.